Good afternoon, everyone. This is Alfred again. Before we start, don't forget to hit the click and subscribe button to have updates and for my latest videos. Anyways, this is the third of the 50 series for the NCLEX test taking strategies, and the third one would be don't read into the question. So that means we have to read every word in the question and specifically determine what the question is asking. Therefore, it is important to be specific and making sure that you know what the question is asking for. And also, sometimes as nurses, we tend to overthink things. We should only focus only on the information in the question and avoid asking yourself, well, what if this, what if that, what if there's another situation? So we have to make sure that we think within the bounds of what the question is asking you, right? And don't overthink and don't put any other situations that are not in the question. The number 3 would be look for the keywords in the question, such as early signs or late signs, because obviously the early and late signs are different from each other. For example, let me think. For example, the UTI, urinary tract infection. The early signs and symptoms of UTI are burning or pain during urination, which is dysuria. Also, frequent urination or polyuria, as well as bloody urine or hematuria. And lastly would be the pressure or cramping in the groin or the lower abdomen. And that would be the early sign, right? So on the late sign of UTI, that would be late chills. Well, that would be chills, fever, vomiting, as well as the back or side pain. As you can tell, as you've noticed, during the early sign, it's concentrated on the lower abdomen or the groin area, while on the late part, that would be on the back side or the side part. That's because obviously in the early signs of UTI, only the bladder is affected, while on the late sign, the kidney is affected. Number 4, in multiple choice questions, multiple response questions are questions that require you to number in order of priority. Read every question or option presented. Again, don't be in a rush. Take your time and take in whatever the choices are. Number 5, use the process of elimination when choices or options are presented. Reread the question and what the question is asking specifically to assist you in determining your final choice or choices. Number 6, with questions that require you to fill in the blank, focus on the information in the question and determine what the question is asking. If the question requires you to calculate or medication dose or intake or output amounts, recheck your work in calculating to verify the answer. Yes, always double check your answer, because sometimes when you're in a stressful area, you tend to be in a hurry and you tend to overlook your math or your multiplication, or your addition even. So make sure you double check and the ML or the things after the number is not relevant, because as long as you have the correct number, that would be sufficient enough. That would be considered a correct answer, right? So just take your time and double check your answer. 7 and last for this particular number 3 strategy would be, remember to focus on the information in the question is asking. That's about it, and have a nice day.